Dr. Malkin, I saw Teeth in a Day commercial, and it seems to be that it's just going to be perfect and just going to be like natural teeth. Is it true?
Unfortunately, it's not always true. So obviously, we're going from a natural dentition to a prosthesis, a bridge, something prosthetic. So I always discuss this with patients. They might feel after the surgery that this is much better what they had before, because what happens when we actually do this procedure, it's usually for people who are missing teeth, they're in pain, their bite is not stable. So when they go through the procedure, they actually do feel much better. However, I want to always create proper expectations. It's not going to feel exactly like a row of natural teeth. And sometimes we have to take into account that some patients are more adaptable than others. For example, some people can wear very uncomfortable shoes and they're fine. And some people need to have very comfortable, very worn-in shoes to feel comfortable. So the same with the teeth and the prosthesis on implants. Some people adapt much faster than others. But I always create an expectation for the patients so they understand what they will face after the surgery. It will not feel like a row of natural teeth. There's some thickness to the implant bridges because there's all this hardware that we need to have to connect the bridges to the implants. So they are thicker than a row of natural teeth. However, it doesn't mean that they're not going to be able to function normally or not going to be able to be comfortable. There's just going to be an adaptational period that they will have to go through. And some patients have a longer period and some patients have a shorter period. And some patients will tell you, oh, this just feels just like my natural teeth. And I feel no difference. Whereas some other patients will say, you know, this is what I expected. I know it feels different, but I'm functioning much better. I look much better. And I'm happy with the results. But you have to create this expectation in advance. So before patients go into the procedure, they know what to expect.